Hello, everyone. I'm Hartford Healthcare's Tina Verona. We are all about sports health today. Joining me live is Eric Smullen. He's the Vice President of the Hartford Healthcare Rehabilitation Network. Eric, thank you so much for joining us.
I'm glad to be here, Tina.
We appreciate it. Well, this is a very unique program that we have here at the Hartford Healthcare Bone and Joint Institute. It's very comprehensive. We're going to delve into all of those details. But right off the bat, what sets this program apart?
One of the things that's most amazing, well, first of all, it's in an absolute beautiful setting. So the Bone and Joint has all the resources that you'd possibly need, with nutritional kitchen to do demonstrations, to teach people how to eat. We have an integrative medicine program. We have a movement laboratory. We have specialized equipment that unweights you while you train. So the fact that everything is together, not just the equipment, but also the people around it, makes it just a tremendous place to be.
Absolutely. We watched just a few weeks ago, along with the world, the Olympics. And really, I mean, this is like having an Olympic training facility here in Hartford for all of Connecticut and beyond. Tell us about that.
So it is true. We have the same technology that some of the Olympians actually utilized to actually look at how they move. And so how they actually refine their movements so that their performance is absolutely at the top of their game. So we have, our movement laboratory has actually 10 cameras that when you're set up with the infrared reflectors can actually track all the fine movements. We have force plates that are built into the floor that will actually record all your movements, whether you're jumping, cutting, or doing any kind of sport movement.
So we're talking about the Motion Lab inside the Center for Musculoskeletal Health at the Bone and Joint Institute. And this is really fascinating because if you have a golfer, if a baseball player, this type of assessment is so critical because you've got those 10 cameras that are recording literally your every move. And then the athlete can go back with the trainer and actually see for themselves if they're overcorrecting or what they might be doing wrong. Is that right?
Absolutely. You know, anytime you have an injury, you oftentimes, even though you feel like you could be able to get back to your sport or your game,
right.
There's oftentimes your body guards things. You're programmed not to necessarily use the right movement patterns if you have pain or if you have restrictions somewhere in your body. And so this movement lab allows us to really just measure it. So not only can you compare to yourself, but we also have the ability to compare to, let's say, a golf pro. And we can say what is normal and what you want to get back to. So it's really amazing. So it's not just a physical therapist or an athletic trainer that's actually doing this analysis. We have a biomechanist that actually specializes in the study of movement. And so it's really high-end, high knowledge-based treatment that you're actually be able to have access to.
And seeing is believing. When you can see it, it makes a huge difference in whether you're recovering from an injury or whether you're trying to enhance your athleticism.
It is. I mean, you certainly can do good care without this kind of resource, but when you have it, it actually raises the bar on the kinds of things that you can see and that you can change.
Yeah. This is not just like any sports health program. What sets it apart and what is unique about it is the comprehensive, multidisciplinary, faceted approach that we've taken to sports enhancement and to overall sports health. Let's talk about some of those dynamics and sort of each component and what the roles that they all play.
Yeah, well, you know what? When you come to the Sports Health Center at our Center for Musculoskeletal Health, you actually just don't come in for an average appointment. You actually get a series of screening tests that you'll go through, and then you'll meet with a point person, whether that's in integrative medicine or whether that's with therapy, depending on why you might be seeking out care. And we actually design a customized program that pulls from all these different specialists. Many of these specialists actually practice right there on site. So the collaboration between professionals is unlike anywhere else. So you can get good therapy somewhere, you can get acupuncture somewhere, but you can't get a place where the therapist, the acupuncturist, your nutritionist, your physician all come together and talk about you to make sure that your plan is actually so personalized.
Yeah, and that's the benefit of it too, and psychologists too, because after you have an injury, especially for an athlete, that can be traumatic, especially if they're not up to par or how they were playing prior. That's very key.
And as a matter of fact, we've had such success. So Hartford Healthcare has done a really amazing job of partnering with behavioral health specialists, not just here on the campus, but also out in the community. But one of the resources that we've been able to do is to look at those psychological barriers to returning to, and we talk a lot about sports, but it's also about returning to basic things like life. You've had an injury, and it's also, you have some fear that it would happen again, whether your knee might give out, and so you favor it. And when you address those, not just from a physical standpoint, but a psychological standpoint, you actually hit your recovery goals.
Yeah, and probably a lot quicker too, right?
Yeah, absolutely. Sometimes, so we say that the body's is programmed, it's going to heal at a certain rate. But there's lots of barriers that get put in the way. Sometimes you favor it, you don't use it normally. Sometimes you, just by the fact that you're not eating the right diets or you're not getting the right sleep, or those are other things that create barriers. When all of those barriers are recognized and you have those incorporated into your program, you just start, everything goes as planned.
Right.
And so we put a lot of people back on plan after they've not had success in other places.
Yeah, or their recovery has taken a lot longer, or they may not see the results that they're quite looking for even too, right?
Well, it is, because sometimes without the collaboration and without the constant asking, why are we not on track, without that constant inquisitiveness and the resources of the collaborative team, you don't always recognize those things that get in the way, but we provide that.
And I think too, and frustration is key as well, because especially in the recovery phase, if people aren't seeing results, or if they're being slowed down, they tend to give up, and they're like, you know what, I may have 2 more weeks of physical rehabilitation, but you know what, I'm not going to go, it's not working, it's not for me. Do you see that with this comprehensive nature?
We do, and one of the things that's fabulous that we bring to the community is the fact that if you are struggling with any kind of recovery and you're not getting the answers, it's not progressing on time, you have to recognize your body's trying to heal, there's something in the way. And our Center for Musculoskeletal Health, which houses the base of our sports health program, can be that answer to find those problems.
Yeah, we're talking with Eric Smullen. He's the Vice President of the Hartford Healthcare Rehabilitation Network. We're talking about a very unique program here at the Hartford Healthcare Bone and Joint Institute, the Sports Health Program. We have a question, Eric, from Sue, and she writes, my daughter tore her ACL in December, very common condition that you see a lot of, I'm sure. She had her surgery in January. She's a soccer and a basketball player. My question is, when she starts up playing again, do you recommend her playing with a brace? I've heard pros and cons to this, so I'm wondering your thoughts. So thank you for that question. What do you think?
So actually it happens both ways, and it's really your surgeon's preference about how you actually choose whether to brace or not. Part of that is how the surgeon's been trained, but it's also looking at which sport they specifically play and at what level they're trying to play, and so that's a decision that you'll make with your physician. But I will tell you, when you get to that point where you're going from your rehabilitation standpoint out to sports, oftentimes when you're just back walking and running, you start to separate from your health professional. It's really not the time. We have what we call a bridge program that actually gets you from the time you're done just getting your regular routine care, that takes you all the way through sports-specific training, that decreases the incidence of re-injury. So what I would recommend is have that dialogue with your surgeon specifically and with your therapist, but then consider just when, not after the 3 months when you're feeling pretty good, but what happens, how do you get yourself specifically ready for sports? And with our testing ability, we actually go through a full sports analysis that is sports specific and make sure that you're ready to do the specific things that are required in your specific sport.
Great question. Thank you for that answer. You know, spring, today's officially the first start of spring, actually probably right about now, or the next few minutes. So spring sports are going to be kicking off into high gear. Would you recommend parents of high school athletes or come and do an assessment now? Is now a good time for an assessment before those springtime sports kick into high gear?
So Well, I talked a little bit about movement patterns, and we all don't move in the ideal way that actually supports good musculoskeletal health. Sometimes we just have these things, and you notice about them. You watch somebody run, and you see their hip do something or leg do something funny. Well, those movement patterns over time with repetition can actually break down the joints. And sometimes it's from a flexibility imbalance, sometimes it's a strength imbalance. My recommendation is that you actually figure out what those imbalances are and then start to incorporate those in your warm-ups and in your conditioning so that you correct those.
Right.
And then you put yourself at a lot lower incidence of any kind of injury.
Sure, and that's where this assessment, I think, is critical, because then the motion lab is part of that. So kind of walk us through, if a parent out there is watching us right now and is thinking, maybe I should have my child go through this assessment program, what's the first thing they do? Just kind of walk us through the assessment process.
Sure, so there's some differences whether you have no injury and you're absolutely, totally able-bodied and you're just ready to playing sports and you'd like to get involved. That's one tract, and sometimes you've had a nagging injury that you're a little bit worried about. So if you make a call to either our sports health line or directly to the Center for Musculoskeletal Health, we screen you to make sure that you've had, we really look for this partnership with our physicians. And so we actually collaborate with your physician, or if you don't have one that's a sports physician that's really focused on what you're doing, we can get you one if you're dealing with an injury. And then in partnership, we will make that assessment, screening for the barriers, make you a customized program, and you have what we call a functional mobility screen when you come to see us. And that's really where we look at all those imbalances. We have you go through a series of maneuvers where you're squatting and lifting and turning and showing off your strength. And we look at it right side compared to left. And those actually start to point out where you have problems. So from there, we build you a customized program. The movement lab comes into if you are really trying to refine your swing or your running ability, or if you've noticed that symptoms occur with those kinds of motions, we actually offer you those as opportunities to get screened.
So you really know where you stand.
You absolutely know where you stand, and you have a plan. You have a clear plan on how you correct those imbalances and what you will need to work on. We really pride ourselves on, with the collaboration, finding the root cause that could either be the secrets to success in your performance enhancement or the root cause that are limiting your progress towards healing something.
Right, or could create an injury.
Or that could absolutely lead to an injury.
Yeah. So we have a question from Laura. How do I know if I tore my ACL? Is that when you hear sort of that popping sound? Or?
Well, sometimes, yes. So the worst case scenario is you're on a field, you're doing a movement. I guess it doesn't always have to be in an athletic competition that you tear an ACL. But the most characteristic tearing is when your leg gets twisted, when your foot is planted, and you hear this loud pop. And your knee gives way, you have a big swelling event. I will tell you that sometimes, though, and then you're really disabled after that. You can't walk on it. You really go to the doctor. They test your movement of your knee, and it shows that ligament is no longer holding the bones together the way they're supposed to. Short of that, we don't see frank ACL tears with just repetitive movement. We see some laxity. Your knee gets kind of looser. So that kind of assessment, if there hasn't been a frank injury, you really need to get assessed by a professional that knows how to test for that ligament.
Laura has a follow-up question. What is the best way to prevent sports injuries?
Well, let's talk ACL for a moment. There's plenty of ACL prevention programs around. We offer one through our Bridge program, but we also actually have programs in our high schools where we're actually teaching the trainers and the coaches how to have people warm up so that they do these preventative types of activities, and really training the body to be able to dissipate force and to deal with the rotational forces that often cause ACL injuries.
And warming up is so critical. It's so essential. Do you find that when many people come in with injuries, it's usually related to, well, perhaps they haven't warmed up enough? I think people underestimate warming up.
Yeah, it's often a component. These body movement patterns that allow us to accelerate or decelerate are things that you can't just get out of a chair and have work for you.
Right.
And so, the old stretching regimens that sometimes, unfortunately, some of our coaches are still deploy, where people sit around, they reach down, they touch their toes. Those are old style flexibility. We do a dynamic activity warm-up for all of our athletes, and recommending that they're moving through their warm-ups. So if you're still doing the old-fashioned stuff, you really need to reach out to your coaches, have that conversation, and then if you need that outside resource, we can be a great source for education.
And warming up and cooling down after exercise is also critical too in preventing injury. A lot of times you hear of athletes complaining about stiffness or soreness after they've either run a marathon or participated in some type of sports athlete program. So that's critical too in preventing injuries.
It is really important, because as you get done a big exertion, really what happens is your muscles get worked, they get shorter. You really need to maintain their normal length, and really, especially when you're successive days competing, you really need to make sure that you help those muscles regenerate. Even more important sometimes is your nutritional intake and how you balance that. So there's so many elements that we've learned about exercise physiology, muscle physiology, and sports health.
Yeah.
And so that's really bringing all that knowledge together to coach people how to take best care of themselves is really the hallmark of what we do.
And it works. You can prevent injuries that way if you just sort of follow that course.
It's amazing, the statistics when you do the right things to correct your problems.
Right.
We've seen great responses to strength and conditioning programs that we've got deployed out in the high schools. We're actively today decreasing injuries, because as our athletic trainers are deployed to the schools, they're having the kids do the right things. They're having them build strength the right way and do the preventative programs.
And I know, and I've imagined that some of them that have gone into the schools, the local high schools, they probably have seen where this is a real need.
You know what? Every high school has this, they get into a cycle where everybody's team, there's a football team or a lacrosse team or a soccer team where there's recurrent tears or recurrent muscle strains. This happens in every school and in every athletic team, unfortunately. And it doesn't have to, though.
Right.
If they do the right management, and the coaches buy in and the kids buy in and they understand what it means to do these corrective patterns and identify it, you really can have great success with your teams.
It's a real commitment, and I think what you've done by going to the high school is sort of build that all into the curriculum. So it's not like a real added step, it's just part of it.
We do, and so we're in 9 local high schools where we provide care, but we're also out in the community. You know, we've been really working with the Hartford Marathon Foundation, making sure that the runners actually have the opportunity to understand what good dynamic stretching is, how to actually prepare. We actually have a training program we're doing for Spartan races that incorporates making sure that people understand their corrective movement patterns, so that they incorporate that into their training and they get the right guidance.
Yeah, and at large events like you were just talking about the Hartford Marathon, we have a stretching tent there where athletes before and after the race are there stretching, and that's always quite popular.
It is, and you know what? It feels amazing after you've done a big exertion to do the right thing. Imagine that.
Right.
Something that feels so good is so good for you.
Right.
But you know, we're actually and we have a tent at actually about 80% of the Hartford Marathon Foundation races, where we have our sports health resources there to interact with the community, answer questions, and actually get everybody on board with good sports health.
Yep. Laura has another question, a third question. This is a great one. What are the best practices for ice and heat immediately after an injury occurs? That's always, you always wonder about that. Do I ice it? Do I put heat on it? What's your thought on that?
So the basic guideline is after an injury, you ice down. Particularly if it swells, or if you can touch it and it's painful, you should be icing immediately. We generally recommend using heat as you're coming off an injury to try to loosen things up, but the goal of the ice is actually to decrease swelling. There's some other elements you do, not just ice and heat. We really recommend compression and some elevation to try to really control some of that initial swelling that happens after injury.
I want to talk about some of the equipment that we offer at the Bone and Joint Institute in the Center for Musculoskeletal Health, and we were talking about the Olympic training facility, and one of those pieces of equipment that we have is the Alter G, the anti-gravity treadmill. Now this is really really neat. I know Tom Brady uses this, but this is really good for if you've had hip or knee surgery or you're coming off of an injury, because it literally takes the weight off of you so that you could actually run on a treadmill.
It's really pretty amazing. You're actually in a belt that actually seals you at the waist, and through air pressure, it actually raises your body weight, comes off your feet and your knees and your hips. And so you're absolutely right. As you're running, as you're walking, it feels amazing to have weight off of you. So whether you either struggle with weight and you have an injury, and you know, the quicker you move, generally the quicker you return and your body heals. But sometimes when you have a weight problem, or if frankly some of the surgeries or the rehabilitation that you do is, you have to be so careful not to overload some of those tissues.
Right.
It's a perfect way to get trained.
And you feel weightless.
You do. It's amazing.
You can't feel like that all the time,
all the time, right?
Just
if
take
you lose
that around
50% of your body weight, you feel like you're walking on air.
You'll just float along, right?
Yes.
The VO2 max, this is good for breathing and to help breathing. Now, I think that's another area, another critical area where a lot of people overlook. But breathing is a huge component.
It is. So you're talking about the VO2 max and its ability to actually measure how well the oxygen perfuses into your body so that your muscles can actually utilize it.
Right.
And so we actually are able to measure that, so we can put people on a rowing machine. That's typically where you're doing really high cardiovascular activities, whether they're runners or cyclists. And you talk about the Olympic training technologies. That's one of them that isn't just anywhere. It's not available in gyms. You have to come to a location to really get tested at that level, and we do offer that, and it goes well. We have people every week in there utilizing that equipment.
Oh, I bet. We're talking with Eric Smullen, the Vice President of the Hartford Healthcare Rehabilitation Network. We have a question from Rebecca on Facebook. She asks, will changing out sports seasonally help in avoiding sports injuries? Good question.
So it's a wonderful question, and really the conventional knowledge is it absolutely does. It's because it balances your body, and it gives you a chance to not overuse certain movement patterns. A lot of the injuries that occur within sports and in our daily lives, frankly, are repetitive strain injuries. So it's when you do something over and over and over again. We're built for a certain number of repetitions. Even the best exercises and even the most balanced bodies can still break down if just with overuse and overtraining. So by encouraging kids to really play multiple sports, complementary type sports to what their primary, maybe they excel at, is really the best convention.
And then I think also that assessment too is critical, because again, you sort of have that roadmap. You sort of have that to follow.
You're absolutely right. That absolutely is so beneficial.
Yeah. So who can really benefit from coming to the Bone and Joint Institute? Is it just athletes? Is it everybody? Who can really benefit from this?
So one of the taglines that we really decided that we really identify with, it's the way you compete. It's for any way you compete. And so, and frankly, so I used to run all the time. I'm not doing that anymore. I like to still think of myself as a cyclist. I'm not doing a whole lot of that anymore. Right. But I have to be honest with you, every day I have the opportunity to be taking the stairs and staying active. Right. And I have to tell you, when I walk the parking garage here at Hartford and I'm on the 6th floor, it is an athletic activity to be doing that staircase. Yeah. And so anybody that actually is trying to be active and trying to set their own activity or performance goals really is our patient. We just made sure that we can deliver on the highest demand that our patients and our clients are going to have, but we really have a very broad application of our capabilities.
It's tough to get old, right?
It is not easy.
As we're getting older and climbing the stairs, but it really is for everybody. I mean, it's for the baby boomers who have hip and knee replacement surgeries. It's for high school athletes who are trying to enhance their athleticism. It's really just about for everybody.
It is, and I'll give you a great example. Just on Friday, we have a gentleman that had hip replacements, actually had 2, and had a shoulder surgery, and came to us, and is a golfer, and he came to us and said, you know what, I would like to see how well I'm doing. And what does it look like now? And he used to be a scratch golfer.
Yeah.
And so we tested him, and he's got all kinds of things don't work the way they normally did.
Right.
But he still has performance aspirations. So we were able to measure them, and we're actually creating a plan to help him mitigate all those problems. So he's really pleased. It's for everybody.
Do you find that when someone goes through the assessment process, or even when they're in the motion lab and you're recording them and then you play it back and you show them what they're doing wrong, do you find that they're almost always amazed, like, gosh, I didn't even realize I was doing that?
Yes, you don't realize even something as simple as stepping down and doing a squat, you don't realize how much your knees turn in, or your shoulder lags back, and all those like inherent kind of twists and turns, they put excessive twisting stress on your joints that aren't good as you repetitively do them. They really break down our bodies.
And even for somebody who experiences a lot of chronic pain, like maybe back pain, or that always says, God, I always have back pain after I'm walking or something, that's really good for those people too, to be assessed and to see what it is they're doing.
They might not utilize the higher end sports analogies, but these whole concepts of however they're going to set their performance goals. It's about movements. However, they're going to set their performance goals.
Yep.
Yeah.
Okay, another question from Rebecca on Facebook. How long should my child rest before returning to activities after an injury?
So that's a great point. And so I just like to start off by saying the category that you're talking about is injury is a very broad and wide. So we don't know what injury that you might have been recovering from. But I will tell you that in the state of Connecticut, all of our high schools have athletic trainers to help make that decision. Your physical therapist and your orthopedic surgeon or your sports medicine specialist can really help make those decisions with you, because there's not a specific prescribed time. Sometimes it's actually better to return to some activity, even athletic injuries like inline running, but we wouldn't let somebody go back to cutting and twisting. And so sometimes it's better to practice in a scrimmage, but we wouldn't want people competing in games.
All out.
And so those are decisions that you have to make in concert with your healthcare provider.
And that's what's good about the program too, is that everybody is under one roof and they're all collaborating. So you know that once that decision is made, everybody's on board with that.
Absolutely. And I'll tell you what's really interesting as we talk about this team, concussion is another thing that comes up to say, do we just hold people out or do we get them engaged? We have great orthopedic surgeon partners, but we also have non-operative sports medicine specialists that are located within Hartford Healthcare Medical Group in both Glastonbury, Avon, and in Farmington. And they actually look at the same thing that therapists look at, but they take that medical healing model into consideration, make sure that the return to work instructions are very clear so that coaches and people at school know exactly what sports doctors feel is comfort for clearing them to go back to play.
Yeah, absolutely. Eric, we have another question from Samantha Cohen. Under what conditions should an athlete seek medical attention for an injury? Thanks, Samantha, for that question. It's a good one.
It is a really good one, because a lot of times you say, well, I'm just going to ice this and I'll be fine, or not even ice it sometimes, I'll just limp around on it. I would tell you that for most injuries, that most pains that you get while you're exercising don't necessarily really turn into full-blown injuries. They're minor sprains and strains that, with a good night's sleep and a little bit of moderation of your program, do resolve in the next 3 days. And so the ones that you really worry about is where there's any trauma involved, where you get an immediate swelling event of any part of your body. When you see a large swelling come, whether it's your knee, you twisted your ankle and it blows up, or it's suddenly very discolored, you really always have that chance that maybe you did something more than a sprain and really need to get to a provider to help assess that. If you have problems making that decision, we've actually created a call line where that you can get that kind of guidance around those individual situations. One of our athletic trainers actually will respond to that, give you that guidance, and can connect you with the right people.
Yeah, that's a good point. So Lori wants to know if the Motion Lab is only for sports-related injuries.
No, it is not just related. It can visualize anything. Now, there's different kinds of movement laboratories. There are some that you do for clinical study, and they're set up certain ways with 25 to 50 feet and walking down the middle. We did not choose to do that. We wanted a clinically oriented movement analysis lab, which means really we can simulate any movement, whether it's a sports movement or not, measure it, and actually help physicians with clinical decisions on what they might do for a surgery or what maybe an orthotic that you might want to utilize. So so it's really adaptable.
Yeah, it's multidisciplinary for really anybody. Kelly asks on Facebook, does insurance cover the assessment fees?
So that's a great question. Sometimes it does, especially if you have any kind of injury that you're recovering from. All these assessments are compensable by insurance. And so insurance does not typically pay for only return to sport activities. So generally, you really have problems in your life. Sometimes when you have a running problem, it doesn't really just bother you when you're running. You notice it when you're on your stairs, you're avoiding taking that. All of those kinds of things, those are compensable by insurance. So really call and have that conversation with our providers representative, and they'd be happy to really dice that out for you.
Yeah. Another question on Facebook, Betsy Foster asks, if ACL surgery is recommended, is it better to do physical therapy prior to surgery as well as after surgery? So pre and post.
So that is an absolutely wonderful question. It is so I will tell you that a lot of whether you choose to do therapy before and after depends on a lot of factors that you'll discuss with your orthopedic surgeon, because they take a look at what your preoperative condition is. So if you aren't actually activating your muscles well, maybe you've had a big swelling in your knee, and the muscles kind of go to sleep when you have a big swelling. And if that's the case, jumping into surgery without having good muscle activation isn't really the best recommendation. But that dialogue is what you'll have with your surgeon.
Right.
In the ideal situation, you go into a surgery as best prepared as possible, learning exactly what you do the moment you're done surgery and what your plan's going to be the first 2 weeks.
Yeah, that's a critical conversation I think that you should have with your physician, because to properly diagnose, because you don't want to re-injure something if it's already injured, or if you have pain, you don't want to make it worse.
Even more, the more informed you are with exactly how you train your body and how you're prepped, the better your rehabilitation, your postoperative course, the quicker you go.
Recovery.
And so we really look at all aspects of this because our goal is the best outcomes possible. That the quickest, and we also say the most durable, the ones that are lasting. There's, especially related to ACL, the worst thing you would ever want to do is go through all of that and then get into a re-tear situation. So following the recommendations of your surgeon, but also the guidelines that the Bone and Joint Institute, our sports health program, has created, create these durable, lasting rehabilitation experiences.
In the safest way.
In the safest way, it does.
Laura Herm asks, do you suggest finding a safe variation of exercise for a permanent injury to avoid muscle atrophy?
Absolutely, and I think that sometimes it's really challenging for you individually to figure out how best to not do this, but to do this and still get the same result. And so when you're an athlete, sometimes you could call that cross-training. But when you have a permanent disability, you absolutely want to find ways to not stress one area, but to still get that action. Unfortunately, some of the general personal trainers at the local gyms are not good at that. It really takes a higher level of understanding from a strength coach that's been specially trained or affiliated with a program like ours.
Sports medicine specialists.
Sports medicine providers that really can help you get to the bottom of that.
That's a whole other area of expertise. A very specific, highly targeted area of expertise.
It is, and you know, one of the things that's part of our mission at the Bone and Joint Center for Musculoskeletal Health is to do a lot of teaching. So we have some community-based classes where we don't intend people to come downtown Hartford forever, but what we want to do is show people that may have some challenges how to safely exercise over a period of time. So I would really encourage you to to kind of look at our class schedules and see if that's a learning environment that you might feel comfortable in.
Yeah, we do have a list of classes on hartfordhealthcare.org, so if you'd like to look at those classes and see where those types of classes are going to be offered, that is really helpful. Janet asks, Eric, how much time should you spend on stretching before or after a workout, specifically as a runner? Yeah, this is always important to stretch. We talked a little bit about that before, but how much time really should you spend, and what should you be doing?
So we talked a little about this, and it is somewhat individualized. So I wouldn't tell you have to stretch for 15 minutes. Those are some general warm-up rules that what I will tell you is that the kind of stretching and the kind of warm-up is absolutely sometimes the most key. So if as a runner, if you're spending between 5 to 10 minutes doing the right thing, and if you were to navigate to the Bone and Joint Institute, the Center for Musculoskeletal Health, we have a dynamic stretching workout book that's there that you can download, and it actually shows you as a runner what we recommend for good, we call it dynamic warm-up, not the sitting on the ground stretching your hamstring, but actually moving your hips, moving your knees, moving your calf muscles and ankles so that you really get good flexibility before your activity.
Yeah. So the number to call is 1-855-800-4040 if you'd like more information about the sports health program at the Hartford Healthcare Bone and Joint Institute, or if you'd like to learn more about how to sign up for an assessment. We'll take care of you at that number. What kind of, what should folks be asking when they call? Like what should they be saying once they call that number? What are some of the things that...
So I think the first thing they're going to ask you is, did you just have an injury? Or so do we need to get you immediate care? So our sports health collaborative that we've created within Hartford Healthcare, of course, if it's a terrible emergency where something's not only broken but bleeding, you need to go to the emergency department, your local emergency department. But our Go Health urgent care centers and our urgent care centers that are associated with our orthopedic partners, orthopedic associates, are out there in the community really as your primary resource if there's an injury. If that's not the case, really tell the person that answers the phone what you're looking for. Sometimes it's informational, and we'll have somebody make sure that they get that information directly to you. But sometimes it's advice on injuries. And all you need to say is, hey, I need some advice. And our athletic trainer is going to call you back within 48 hours. And if it's during the week, it'll be within 24. And they will actually have that conversation with you. If you need that stretching book, they could probably email it to you. If you need coaching on what physician to go to, we also work that way.
You mentioned the Hartford Healthcare Go Health Urgent Care Centers that are involved with the orthopedic associates. There's one in Glastonbury, I believe one in Farmington, but you can go there and you could have x-rays taken too on a sports-related injury too.
Absolutely. You have one of those injuries where you get that big swelling event, or if it turns black and blue. Really the safest thing is go get screened by the urgent care provider. Let the medical provider assess it, and if necessary, they'll take an x-ray, and then you'll know whether that's something you can wait on and do at home, or whether you really need to engage the rehab services.
In your opinion, what is the best way, what's the takeaway message here for folks watching to prevent injury?
So prevent injury is actually acknowledging that there's something you can do about it. That all of us have normal way, the best way to move, and then the way our body always chooses to move. And when you look at how you identify those problems and you address them, you get ready for your your activity, no matter whether it's stair climbing or whether it's doing triathlons. When you prepare, you train, and you balance your body, you will decrease your risk for injury.
And speaking of injuries, what do you say to somebody who suffers an injury, whether it's an ACL tear, whatever sports-related injury, and they say, you know what, I'm just not as good as I used to be? What do you say to that kind of a person who has those thoughts? So
I try to be most diplomatic, knowing what we have, this gem of a program, and I try not to push that on everybody, but I have to tell you, when did you stop trying to address this problem? A lot of times people say, you know what, I just got done with it. I tore my ACL, I went through surgery, I did 3 months of rehab, and I've never been the same. And I would just clarify for people that no one's done it 3 months.
Right.
That
They usually give up long before the 3 months.
Long before your body has actually compensated fully and had the opportunity to regain. So most of these things, this isn't coming to a facility. It's learning what to do, and then just being your own advocate and being diligent with these programs.
Yeah, it's really empowering you with the knowledge to go forward, but also in an injury, you have to give it time too. You have to let the body heal.
You do have to go through a normal healing progression.
And that's hard for athletes because they want to just get right back, and they want to get back to sports, and they want to get back to doing what they love to do. So it's a hard compromise, right?
It is a hard compromise, but getting back into what you think you should be doing before your body's ready for it is where a lot of people stop off. I don't have any pain, I ran, I'm fine.
Right.
But the problem is they're really running on an imbalanced body that's really not ready to do what they used to do.
And that's when you probably see a lot of re-injuries.
That's when we get the re-injuries.
Right?
That's when we get the ACL re-tears. It's not quite ready.
Yeah. Well, so the number to call is 1-855-800-4040 if you'd like to learn more about the sports health program. Eric, we have another question from Lori. Will the urgent care centers be able to get you an appointment with one of your orthopedics quickly? It's very hard to get appointments quickly with some of your more reputable physicians.
So I will tell you that the commitment to be part of this sports health initiative is that you have to offer 24-hour access. Yep. So that has been a typical challenge everywhere. How do you get into a specialist? But in this collaborative that we've created for Hartford Healthcare, everyone is focused on 24-hour access. And this is one of the reasons why we actually created our navigation with our athletic trainer, because you're not out there left alone to try to to get an appointment. If you need help, that athletic trainer, our navigator, will get you an appointment in 24 hours and with some of the most reputable specialists in the area, in whatever it is. And I will tell you, same holds true. If you're an athlete and you have problems with dizziness or fainting, or somebody's told you that you feel like your heart skips a beat, we have cardiologists, sports cardiologists that are associated with our group that will see you. They have a sports clinic every Friday, but will take accelerated appointments based upon need, because they realize that good sports health care means prompt sports health care.
Right, and I think and once from the onset of making that call and triaging it, it's important that you have these highly skilled physical therapists, sports medicine specialists to triage those calls and figure out where you need to be going throughout this whole program, right?
Well, I will tell you, it's so important that you get connected with the people that communicate. And so I think that's one of our other things that we do in our program that is really unlike anywhere else. All of these providers collaborate on a regular basis. Tonight, we're bringing the key members of this group together, that we come together on a monthly basis, and we talk about how well we collaborate, how well we're reaching out to the public, and how can we do better. It is when you get referred to one of the partners, you're going to see a sports health provider. You're not going to see a therapist that specializes in occupational health or workers' injuries. It will be a sports health provider, and that's some of the opportunities that you have when you partner with us for this program.
That real multidisciplinary team who is in constant communication about a specific patient, I think, is so critical.
And doesn't just see you as a knee, but sees you as a full person,
the whole picture,
that sees all the systems, how they all have to work together, and has the facility and resources to be able to provide that care to you.
Eric Smullen, this has been a wonderful conversation. Thank you so much for answering all the great questions that we've had from our audience today. We'd like to thank you for joining us. For more information, again, log on to mysportshealth.org or simply call 1-855-800-4040 for more information. Thank you so much for joining us. I'm Hartford Healthcare's Tina Barona. We will see you very soon.